When you slide into an MRI machine, it feels like the device is simply taking a photograph of your insides. But that is not what is happening at all. An MRI does not see your body the way a camera sees a face. It does not capture light. It listens. Hidden inside every part of you is a signal so faint that no eye could ever notice it, and the entire purpose of this enormous machine is to coax that signal out, catch it, and translate it into a picture. To understand what an MRI actually sees, you have to understand what it is really listening for. Your body is mostly water. And inside every water molecule are hydrogen atoms, each one carrying a tiny spinning core called a proton. Normally these protons point in every direction at random, a chaotic crowd with no order at all. But the MRI machine is built around one of the strongest magnets used in everyday medicine. The moment you enter that magnetic field, something invisible happens. Those scattered protons quietly line up, like millions of tiny compass needles turning to face the same direction. You feel nothing. You sense nothing. Yet inside you, an invisible order has formed. This is where most people misunderstand the machine. The magnet alone does not create the image. It only prepares the body. The real work begins when the machine sends a precise pulse of radio waves into you. That pulse nudges the aligned protons, knocking them out of position, tipping them away from the magnetic field. For a brief instant, your body is holding a kind of stored energy that it did not have a moment before. Then the radio pulse stops. And here is the part patients almost never see. The protons begin to relax back into alignment, and as they fall back into place, they release the energy they were holding. They release it as a faint radio signal of their own. Your body in that moment is gently broadcasting. The MRI machine is not pushing a picture into you. It is waiting, listening, catching the whisper your own tissue sends back. But this is where the real intelligence of the technology appears. Not all tissue relaxes at the same speed. Fat releases its signal at one rate. Water at another. Muscle, brain, cartilage, fluid, scar tissue, swelling, each one has its own rhythm of returning to alignment. The machine measures how quickly and how strongly each point in your body sends its signal back. And from those millions of tiny differences, it reconstructs a map. The bright areas, the dark areas, the subtle shades of gray, they are not colors of your body. They are the timing and strength of a returning signal, painted into an image. This is why doctors reach for an MRI when they need to see soft tissue. An X-ray is brilliant at showing bone, because bone blocks radiation. But the brain, the spinal cord, ligaments, tendons, muscles, and organs are soft and watery, and to ordinary imaging they can blur together. The MRI thrives exactly there in the soft and the subtle, because it is reading the water content and the molecular environment of tissue rather than its density alone. It can separate a healthy structure from a swollen one, a solid region from a fluid-filled one, a normal nerve pathway from a disrupted one, often with remarkable detail. And the machine has another quiet advantage. It does not use ionizing radiation at all. No X-rays pass through you. The image is built entirely from magnetism and radio waves and the natural response of your own protons. That is one reason doctors may choose it in certain situations where they want detailed soft tissue views without radiation exposure, though the decision always depends on the patient and the clinical question being asked. Here is something else patients rarely realize. Sometimes a doctor may use a contrast agent, often a substance based on gadolinium, given through a vein. This material changes how nearby protons behave, making certain tissues stand out more clearly on the scan. It can help highlight areas of increased blood flow or particular tissue activity. But whether contrast is needed and whether it is appropriate for a given person is a clinical decision that only a qualified professional can make. Now, the surprising part is what the machine does not show. An MRI produces an extraordinary map, but a map is not a diagnosis. The scan reveals structure, signal, and pattern. It can show that something looks different from the surrounding tissue, but it cannot by itself explain why. A bright spot is just a bright spot until a trained radiologist interprets it in context, alongside your symptoms, your history, your examination, and sometimes other tests. The machine can reveal a clue, but the doctor must interpret the story. And this is where symptoms and scans can become genuinely confusing. Sometimes a person feels significant pain, yet the MRI looks unremarkable. Sometimes a scan shows a finding that looks dramatic, yet causes no symptoms at all. This mismatch surprises many patients, but it makes sense once you understand what the machine is doing. The MRI measures tissue signals. It does not measure pain. It does not measure how you feel. It shows a structural picture, and structure does not always match experience. This is exactly why doctors do not read a scan in isolation. Clinical context is not a formality. It is the difference between an image and an answer. There is also a reason the MRI feels so mysterious from the inside. The loud knocking and buzzing you hear during the scan is not the magnet itself. It is the sound of gradient coils switching rapidly, the components that let the machine pinpoint exactly where in your body each signal is coming from. That spatial precision is what turns a vague body-wide signal into a detailed slice-by-slice image. The noise that feels alarming is actually the sound of the machine carefully locating every point in space. So when you picture an MRI now, try to see past the idea of a camera. Picture a strong magnetic field quietly organizing the protons in your body. Picture a radio pulse tipping them out of place. Picture them relaxing back and whispering a signal in return. Picture the machine listening to that whisper, measuring its timing across millions of points, and reconstructing it into an image that reveals the soft hidden architecture inside you. It is one of the most elegant ideas in modern medicine, turning the body's own quiet response into a window doctors can read. But remember what the image truly is. It is a beginning, not a verdict. It hands the doctor a detailed clue, and the doctor brings the training, the context, and the judgment that an image alone can never contain. Only a qualified medical professional can interpret an MRI for an individual person, because medicine lives in the connection between what the machine reveals and what the patient is actually experiencing. If you want to keep understanding the hidden science behind medical devices and the human body, clearly, visually, and responsibly, consider subscribing and let curiosity guide you toward what is really happening inside you.